So this is such a small detail, but I always try to lift the armrest from the tip of it, and it felt a little bit difficult. But then Anu told me, why don't you lift it from here? And yeah, sure, it's a lot easier that way. And of course, the reason why we can rotate the armrest is that it would be easier for patients to enter the chair. Another thing that makes it easier for patient to enter is this automatic leg rest. So also older patients or my senior colleague can easily enter the chair. There is also another thing I would like to mention about the automatic leg rest. There are some situations where you would like to get the chair as low as possible. For example, if you are treating the patient in this kind of upright position. If you're not that tall yourself, you would like to get it even lower. So in those situations, you can just lift the leg rest and then you can get the chair a lot lower, like this.
You can adjust the headrest length and the angle. The headrest length you adjust simply by sliding the headrest in or out. The headrest angle you can adjust by pressing the button over here and then by adjusting the angle to the desired position, like this. If you treat children, so then you can remove the headrest mechanism completely, like this. Or then you can do so that you flip this headrest around and then you can also use the child cushion set so that you can adapt the chair for children. If you sometimes face a situation that you have to treat a patient in a wheelchair, you can adjust the headrest like this. Then the patient can enter in a wheelchair and get support from the patient chair headrest.
I will first show how to manually drive the patient chair. So the chair moves as long as you keep the button pressed down. So downwards, upwards, or you can tilt the backrest. So you can do this from the foot control, or you also have the same buttons here at the user interface. And if you have this kind of suction arm, you have the buttons here as well. I would like to go more in detail with the automatic chair positions. Here in the foot pedal, we can see 4 letters A, B, C, D. That means that we have 4 different automatic chair positions. If we want to use the automatic chair position, we press the button shortly, and the chair will automatically drive to that position and also turn the light on or off, depending on how it's set. We have here the default settings for the automatic chair positions, but you can of course adjust them to make them perfect for you. First I will adjust the chair so that it is perfect for me. So I'll tilt the backrest, adjust the height, and make sure the light is on if I want it to be on. Then to save this position for me, I go to the user interface and click the programming button. There are different options, A, B, C, D, and I choose this as my position D. And it asks me if I'm sure I want to save that position, and I just click yes. And that position is saved for me. Of course, it saves quite a lot of time in your daily work if the automatic chair positions are programmed just for you. You don't need to adjust the chair with every patient. If there are more people using the same dental unit in the clinic, it is really useful to have your own user profile in the unit. So here we have the list. You can see there is place for 8 users in the Planmeca Compact i5 dental unit, and when you choose your own user profile, the automatic chair positions are available in your preference.
If you need more than 8 user profiles, or if you want to get your user profile available with another dental unit of the clinic, it's a good idea to have Planmeca Plan ID system. The system works so that you show your own ID card to the reader, the system recognizes you, and so you have your own personal settings available with any dental unit in the clinic. There's a rinsing position which works so that when you press here, the chair goes upright position, the cup filling starts, and also the bowl rinsing starts. When you press again, the chair goes to a previous position and the bowl ring starts. And this provides an easy way to go between the treatment position and the rinsing position. In case of emergency, you can get the patient up quickly by pushing manually the backrest up. For whatever reason you have to stop the chair movements, you can do it by pressing any of the foot control buttons or by pressing anywhere in the user interface. There are a few safety features related to the patient chair. If you have the bowl rotated above the patient chair, you can drive the chair upwards a little bit, but it stops before it hits the bowl. And when you rotate the bowl back, so then you can drive the chair more upwards. Another safety feature is that when you operate the instrument, so for safety reasons, you cannot drive the chair at the same time.